Hmm.
Welcome, everybody. We're going to start in the next moment with Dr. Colfax giving opening remarks, and then we'll move forward with the program. You can put questions in the Q&A. Please stay on topic. It's not possible for us to answer questions from all different directions. And we'll get started right now. Hopefully everybody's technical equipment is working. If not, please put a question in the Q&A and we'll see what can be done to help you. Thank you, Dr. Colfax.
Hi, well, thank you and good afternoon, everyone. I'm so glad to be able to join you today as we provide an update on our department's anti-racism and racial equity work. I'd like to first thank the Office of Health Equity for hosting this town hall, a technological marvel, under the leadership of Director Dr. Ayanna Bennett and Dante King, Director of Workforce Equity Strategies and Programs. And I'd also like to welcome and thank our new Director of Human Resources, Luena Kim, who is speaking today as well. And I also want to be sure to acknowledge our department's equity leads who are participating in this town hall. And of course, welcome to all of you. Again, thank you for joining us today. I know that this past year has been a blur of activity as we start returning to some normalcy. I'm looking forward to being back in more regular contact with all of you, virtually through email updates and in person as much as possible, and hopefully more in person as we return back to a more normal state of working and being together. Our department's anti-racism and racial equity work must exist at the core of everything we do and is incredibly important and is something that I'm personally deeply committed to. And our racial equity action plan requires ongoing, sustained, and hard work. And this isn't something that we can address in a report or in an email or a town hall. It represents our robust and ongoing commitment to improve the health of our community, the way we deliver services, and the experience of our department staff. While we've made progress, we recognize, and I recognize, that we still have a long way to go. And DPH can't fully realize our mission to protect and promote the health of all in San Francisco unless we do more to advance racial equity within our department and in the communities we serve. And I know that prior to today's event, there was an ask for questions for people to submit, and there are going to be questions in the chat as well. And I'll let Dr. Bennett, Director Kim, and Director King address those specific questions. But I did want to address one of the questions that I get many times, specifically as it relates to ensuring that the department has diverse and equitable leadership. This is a top priority for me and is something that we're actively working on to continue to improve. Some examples, we're working on a number of leadership and directorship recruitments in primary care, within behavioral health services, and of course, at Zuckerberg San Francisco Hospital. And the Office of Health Equity and Human Resources have partnered together to develop concrete strategies and approaches to enhance and improve our targeted recruitment strategies to ensure a diverse candidate recruitment pool. And these are things that we're looking at and real metrics that we'll be using to ensure that we are making progress in this area. And we're allocating monies to invest in targeted recruitment strategies to aid these efforts, as well as the creation of specific steps to ensure that we challenge biases that can taint outcomes for Black, Indigenous, and people of color candidates. And these are critical investments in ensuring a diverse pipeline of candidates for positions across the department, including, of course, in leadership. I'm committed to ongoing communication with you about our action plan and the department's equity work more broadly, and I'm so glad to be part of today's town hall. And with that, and with much gratitude, I will turn things over to Dr. Bennett. Thank you.
Thank you, Dr. Colfax. So I am Dr. Ayana Bennett. I'm the director of the Office of Health Equity. I'm going to do a bit of a overview that may be redundant for some of you who've been paying attention to all of the equity work and what's been happening, those of you who go to ELS every time. For the rest of you, I want to be sure that you at least have some context of what the Office of Health Equity is. It just started in 2019, and it was not going very long before COVID hit. So this has been a bit of a scramble of the last year, so we'll retreat a little bit, and I'll do it quickly for those of you who've seen it before. Next slide. So just as a review, the framework that we're using several, but one of them is a longitudinal approach for changes in government around equity that's being given to us by the Government Alliance on Race and Equity, which many jurisdictions across the country are part of. And they recommend that you start by normalizing, which is basically setting a priority and making sure that everybody knows what you're talking about. So we all have some of the same definitions. We can have conversations without people feeling instantly uncomfortable that we're open about this topic. We actually started a bit differently than that when we started with the BAHI initiative in 2014. That was really operational. We were actually trying to make some changes. It was clear in some of what we did that not having normalized, not having really had the conversation with everybody involved did have an impact. And so in that time, they also started the Dr. Ken Hardy trainings. 700 different people have gone through it now. It's very long and intensive, but I think did do its job of raising awareness, which is what normalizing is. We then joined the GARE Alliance and started to work on this framework, which meant we next went to organizing, which means having staffing and resources and the things you need to do the work. We've done that. The San Francisco Office of Racial Equity was established by the city at the same time that we established our Office of Health Equity and DPH. From there, we have had designated equity leads in all of the different sections of the department. There is an equity lead related to you. Please know who that person is. And over the last couple of years, we've been able to get one in all of the critical areas. And last but not least, we have now written our equity action plan. I will make a point that the equity action plan is a little different than our normal planning. We usually do A3s and other things, and that planning also is going on. So we do have A3s in our area. You probably have one in your area, and then you should be looking at that too. But today you're going to hear a lot about the racial equity plan, action plan. Go forward. So just to frame this so people understand where the Office of Health Equity sits. So it sits in the executive group along with the CFO and the COO and all of those things that you're used to, and along with some of our offices like policy and planning. Next slide. So the Office of Health Equity has a few functions. One is to get us through that longitudinal approach to go from being really transactional about equity into some more substantive transformation that will be sustainable. So what we're looking at right now is trying to do activities in all of those areas. One is equity culture. That's really where normalizing comes in. It changes the way we talk to each other, the things that we're willing to talk about. And that can be events, just the experience of working here or being a patient here, communication that we do. And many of you have seen some of that. We've had 2 events in just the last several weeks that really opened up the conversation about racism and equity. The other is capacity building, making your area able to do this work. And that means having the data and the training and the staff to really hold the work. And that's where our equity leads come in. That's where the work of some of our champions comes in. All of that gives you bodies and resources to do what you need to do. The other is service quality. So coming down to brass tacks, what we really want is for disparities in health to be eliminated. We don't want it to be possible to tell how healthy you are just based on your race. And right now it almost is in this town. And we also want workforce equity to be happening so that how far you get in the department, whether you get hired, doesn't also have anything to do or can't be tracked based on your race, because we're all succeeding in the system. That also means community partnerships. Our work in the community needs direction from community members. It needs the work and close partnership of community organizations, and making sure those relationships work and trying to monitor the improvement in our service quality are all part of the Office of Health Equity's work. The last is accountability. It's not actually in the GARE framework, but it really matters, especially for us. Having planning where we say what we're going to do so that you can tell when we did or didn't do it. Having data tracking, so we're looking at health disparities, but also about our hiring numbers, also about whether or not our programs are in the right neighborhoods, all of those things. And then having reporting. So we've done the Black Health Report before we even established the office. We need to do more of those with other communities. We have reporting about whether or not we succeeded in our goals, in our training, all of those things. Much of that reporting is becoming more and more mandated as the rest of society becomes more interested in this issue. So that may come to you as something that you need to do to help us really report on what we're doing on equity. And it may change the way you do your work in terms of being able to document people's income, race, ethnicity, and other things that we're going to need to do that tracking. Next page. So I just want to make a point because it gets lost, and especially today when we're going to talk so much about workforce. We really want to keep front and center that one of the most important reasons for doing this is that we need to get past these health disparities that have been going on for decades and generations. We have a gap in how long it is likely for you to live based on where you were born and what the ethnicity and race of your parents was. That's not morally acceptable. It's not our mission. And so all of the projects where we have disparities, and every area that doesn't even have a project yet about a disparity that they oversee, those all need to be really front and center and be taken care of. So this is just a little data from the hypertension project that primary care has been doing. That gap that you see is between Black African American patients who are under control for their hypertension and everyone else under control for their hypertension. The one at the bottom under less control is the Black African American patients. And that gap got smaller over the years of work. It was a lot of years and a lot of work, but it is possible to close these gaps. We've seen that somewhat with our chlamydia screening, at least our performance is better, and somewhat with the ability to really have doulas available to our patients. So things are working, but I do want to just give a little nod to that work before we start talking about mostly workforce. Go forward. Just an overview to show who's in the Office of Health Equity, because it is more than just the people who are there. So we have our different areas that I described: workforce equity, which Dante King is overseeing. Health equity, I at the moment oversee that along with the leads. Equity training, which happens all over the department, and Dante King is helping us with our curriculum. Our community health initiatives, which really the staff for that is deployed, but we'll get back to it. Different partnerships, trauma-informed systems, and HOPE SF. All of that is changing as work in one area grows and another area shrinks or things get transitioned. But right now, I just want you to know what's there. And who is there are a lot of people. You have equity leads and councils in your area. You have health equity champions, and you will have equity fellows. We're rebooting both programs. The Equity Governing Council includes the leadership of every part of the department, and they all meet every 2 months to talk about these issues and approve policy and things like that. The Equity Leadership Team, I think, is about 40 people who are doing equity work around the department. Either their work is about equity, like Black Infant Health, or they are working on equity for their division. So there are a lot of people. It's not just the Office of Health Equity. We kind of hold those groups together, but there is someone in your vicinity who is focused on this work. Go forward. So we're going to talk today about the Racial Equity Action Plan. It is required for all city departments. That ordinance was written in 2019 when the Office of Racial Equity started. It's part of the start of that. They created the framework for this report, the focus, which this time is on workforce equity, and the target activities. We've added activities, we approach the activities differently, but the activities themselves were mandated by the Office of Racial Equity. The budget and staffing approvals for future budget ask that we have in 2023 and on will be based somewhat on our success in doing the goals in our Racial Equity Action Plan, and we'll report on it every year. Go forward. So it has 7 areas: hiring and recruitment, retention and promotion, discipline and separation, diverse and equitable leadership and management, mobility and professional development, organizational culture of inclusion and belonging, and boards and commissions. And we and every other department have problems in all of those areas that need to be addressed. And we will address some of them in 2021. We will work on others in the coming years. This is going to be a weird year. It'll be less disrupted than last year because of COVID, but we certainly aren't at full force, and we're diverted by lots of other ongoing things. So it's a little less intensive this year than it will be in future years. Go forward. So we're going to just list very briefly a few of them. So we're going to be working on a hiring policy, looking at standardizing interim roles and who gets to have them, lots of manager training. The fellowship will be our leadership skills training that's being asked for. Go forward. Tracking professional development, that's going to require a lot of building because we don't have a system that has everybody report what they've done for professional development so that we can start to develop more for people to be able to do. Having a respectful workplace standard in our employee workbook only matters if we actually enforce it. So starting to enforce that and make a process for it. And then lots of things are happening at the board to establish equity in their decision making. Go forward. You can go look at the entire plan with a link that was in the invitation to this meeting. Please go do that or just search for it. So one thing that's in the Racial Equity Action Plan that's required of us is some kind of tool needs to be used by our Health Commission to make decisions so that their decisions are based on whether or not something is impacting equity or not. So knowing that something will increase in equity or actually advance equity should be part of their decision making. We want that to happen, and they need a tool to do that. There is a racial equity tool, many of them that are used all over the country. One thing that isn't entirely clear is that all of those work as well for health. They don't necessarily have the same kind of data or as much rigor or allow for that quality improvement iteration process that we do. So we've designed our own, and we've combined the racial equity tool from the Government Alliance on Race and Equity and the CDC's model of health impact assessment. And so we are building it as we speak. And so many of you are going to encounter that tool and need to use it. And I want to just discuss it briefly because it will change things for how you do your work. Go forward. So the way the tool works is both of those kinds of tools have different sections that are relatively similar. They have a proposal. You've said you're going to do something. You have a data review. In the health impact assessment, you're trying to see if your proposal relates to a health condition well based on data. And you're going to look at the health inequities that exist in your community already and whether or not this will address them. So community feedback should happen. Ideally, that revises your proposal and you get feedback from community that says we want this and not that, or these are our real priorities. The best case scenario is you did that before you even had a proposal, but we don't always get that benefit. So you're supposed to figure out what the unintended consequences might be, make some intended mitigation strategies, and then do your implementation. And that may be your contract, that may be a description of your program. That's where people present to the commission, right, before they start that process generally. Evaluation of outcomes and reporting the feedback to community. We don't all have mechanisms for how to report back, but it would be something that we will have to build because we will need to do that. Go forward. So this will be a challenge. I want to just point out some places where it'll be challenging and why we're going to do this slowly and have a training process. So if you have a program that's being presented to the Health Commission between July and September, you may be someone who needs to join training a few months before that. The reason is that we want to be sure that you're able to report on your proposal by giving evidence of how that intervention is going to impact health. We're not always required to do that in grants and other things, but we will want to try to do it for this. And so if you don't have that evidence or that work hasn't been done, we want to give you time to have done it beforehand. There may be data gaps. We sometimes don't collect race ethnicity data well. We don't collect the data on the condition that you want. It's just not available, but you should do a search. And so helping you figure out what sources you can look for, will be important. And if there's poor quality data, how do you respond to that? The community engagement process, you can't do that at the last minute in the week before your health commission report. So we need to tell you about it now so that you can have something. Many different community engagement processes have already been done. Don't redo them. We don't want to hector the community to get their input. If they've already told us how they feel about X, Y, or Z, we want you to find that information and use it. So we want to be able to get the community a decision-making position, which means there should be ways for many things to integrate community members, or to at least recognize that you need that and we need to build that. You get mitigation strategies. If there isn't anything, then maybe you're just going on community preference. Implementation, you may not have the resources to make it sustainable, but ideally that's what the community wants and needs. And you may have limitations on how well you can target your target group, and the 209 and lots of other things make that hard. And you may not have a medium to communicate, but we will build that. Go forward. So I'm going to flip through some examples really quickly so I can stay on time for this. So there are only 6 questions in the way this works. We're going to expand it. It may be as many as 10, but they're very simple. So the question here is, in one of the steps in the data review, is what does population level data tell you about your racial inequities and where are the data gaps? There are lots of places to find that information. So one example would be the food security proposal that Preeti Rana and Paula Jones let us use for the Health Commission presentation on this issue. And they had done some work to show that food security was worse in Latinx pregnant women and African-American pregnant women. Their focus is pregnant women, and also Pacific Islanders and Asians. And so what amount of food is needed to close that gap, and the needs of their and priorities of non-WIC clients who they weren't able to talk to are data gaps. So they said that. Go forward. Their community engagement process. What has your engagement process told you about burdens and benefits of different groups? Who's going to benefit and who's going to have to pay or lose benefits? And so we want to use information you already have. They had already done focus groups about this issue. So they were able to say that Latinx, Chinese, and Black African American patients had slightly different needs and views. Go forward. And so those kinds of pieces of information will need to be created now. The time frame for this is going to be that the Health Commission committee review already happened in February. We went back with an example in March. They're going to be looking at us to develop a training this month. We've started it in May, and then start to deliver that training. So if you get a call about your Health Commission presentation or the program that you're in, and is planned to be presented, then you may need to be looking at doing a community engagement process that you haven't done, doing some analysis you hadn't done. And then in July, we're hoping people will start using the tool and we'll tweak it a little bit and then get final approval towards the end of the year. And then this will be the way it's done. So that's our goal, to just change the way things are done. And this is going to be one of those times. Go forward. So I'm going to turn it over to question and answer first, correct? Yes. So I don't remember who's going to do the question presenting, but I'm hoping there were some questions in the Q&A. Jessica or Alicia?
Mostly IT questions, so
Goodness.
no question. Yeah.
So Teams has defeated you, unfortunately, and there are no questions. I'm going to answer one question that I've gotten at other times, which is, should we all be doing focus groups? And the answer is no. We don't need to harass the same number of people, and with COVID and just, we've done enough. What we may need to do is try to get some standardized ways in which you can communicate a couple of questions or survey or other things to community without having to independently pull together a group, having some standing community advisory boards. So there are some things that we're going to try to develop this year so that when we're in earnest using this next year, you'll have those things and not have to invent them yourself. But we really should already have been asking community. I know MHSA has a robust process, and so do many others. So if you have a process, use that information. Someone's echoing and repeating me. Is there, was that someone trying to ask a question? All right.
No, but we do have some that we collected from the survey.
Oh, okay. Go ahead.
Jessica or Gavin.
Okay.
If Gavin can't read them, do you want me to read them off,
Yes.
Dante?
Sure.
Just read. Somebody read.
Just a second. Let me just pull them up. Okay. And these are pretty very detailed questions, but I do think they're definitely important to answer. Just love technology. My Microsoft Word is just thinking.
We're in the struggle today.
Yeah. Sorry about that, everybody.
People whose faces you see here are your equity leads from your different areas. If none of them are known to you, you shouldn't know at least one of them because they're the equity lead in your area. And you should look at the list that was given to you about who it is in your area and try to find that face.
Okay, my questions came up. Ayanna, this would probably pertain more to you regarding the True North metrics, but one person said that they are proud of the fact that that equity is one of our True North metrics, but has there been any discussion around considering equity to be the foundation upon which the True North metrics rest on? I think many would agree that each of our True North metrics cannot be successfully achieved without addressing equity.
I think that is how we talk about it and think about it. Whether or not we draw the little picture that way, I think is something we can talk about. But that is the message that we're trying to put forth. And if that is a message that you know and understand well, please say that out loud and make that known in your group. This is not really going to work just by pronouncements from on top. Honestly, you really don't need another letter from Dr. Colfax to start talking about where equity sits in your work. You should talk about it. We only make culture change between relationships between people. It's not going to happen based on posters. And so if you really feel that and believe equity needs to be core to your work, we're putting out that message and we'll do it better and more. But you need to give that message when you guys are talking about a program and when you're talking about your budget and say, where's the equity in this? It should be there. So it's really going to be a lot of people individually acting that is going to shift this. And whether we fix the picture or not, if you don't do that, it won't matter. So I'm hoping you do that, and then I'll worry about the picture at some point. Go ahead.
And we do have some, thank you, Ayanna. We do have some questions in the chat as well, so I don't need to go back to the survey questions, but here's a few of them. One put, there needs to be more accountability from management who actually have implicit and institutional biases. Just as the country is beginning to track bad actors within the community, it needs to be the same within DPH in the city and county of SF. If a person in management has been written up for discrimination, bullying, and harassment, then it should be made available for transparency, as well as making sure the bad actors within management need to be held accountable, just as line staff are.
So I agree, and I'm going to expand that one of the basic principles of racism and how it works that I think often gets missed is that it's not just that it demonizes people, it creates angels and devils. So it demonizes some people and it makes other people get treated in a way that they also should not be treated. So the fact that our managers are not being written up is just as much, if not more of a problem than the fact that people are being overwritten. So under enforcement is really as much of a problem or more because it tends to happen to people in power and therefore dominate the culture as over enforcement. So we're entirely aware of that. That manager training is a lot about understanding and recognizing bias, but it's also about understanding the standard to which you'll be held. So that is part of why we have the directors all getting together, because really it is their responsibility to hold that accountability for the managers below them. That is why we have champions, to be able to sort of watch what's happening and try to help mediate those things by bringing in people to tell their lead that I see something that is concerning to me. You have leads who are not part of your group, so that someone can maybe mediate and talk and try to work out issues. And that's not just working out conflict, that'd be great, but sometimes it's making sure that accountability happens. So there are two kinds: accountability for your own behavior and accountability for your performance. So we need people to actively be making equitable decisions and equity happen. We need them to preserve valuable employees. Those things are all performance. It's not just be a nice person. Those are part of management, is to develop and elevate employees who are serving critical functions, and people who are in roles that give us diversity and various opinions are serving a critical function. So if you are making that go away, you are damaging the institution and you should be held accountable. So those standards are being written right now. The processes are being worked out right now, and it is an entirely recognized problem that we have both sides of racism in our workforce issues.
Thank you. Okay, we have a few more questions. Thank you, Ayanna. This one is about community engagement. Do you think we should, community engagement should also be done through social media?
I think it depends on what your audience is. If you are doing elders around their care, probably not. If you are doing youth, probably almost all of it. So we need to be where community is. So us having a one-size-fits-all method is not going to work, but bringing up a method that we're underusing is exactly right. We need flexibility, and we need to follow the direction we're given. If we have a focus group and 3 people show up, that was the improper method. That doesn't mean nobody cares about the issue. It means you did not give them a proper method to tell you about their concerns. And we need to start to train about how to use a variety of methods, how to tell which method you should use. That's part of what we're doing in the fellowship, and more trainings will come. So management, equity skills, equity policy, community engagement standards, because we also need to make sure people aren't doing things that are us harming the community through one of our employees. So all of those things we recognize as gaps in where we currently are. If you feel you see other gaps, please find your lead and talk about how that might be a gap for you, or you think a gap across the department. We're bringing in new ideas as they come, and there are a billion things to work on, and we need to prioritize. So help us prioritize by telling us what you see is causing the most trouble. Go ahead.
Okay, thank you. And the chat just lit up, so there's a lot of questions now. But the other question, Ayanna, for you is, how will we get updates on the progress? This might be the last question before we have to move on, but how would folks get updates on the process for the REAP?
Okay, so the updates are going to happen at the Health Commission every few months. We just got the webpage for the Racial Equity Action Plan up, and we'll be posting update reports on data as they come. We haven't established the baseline dashboard yet, so some of that stuff still needs to get built. As you can imagine, we were a little COVID diverted in the last 6 months of 2020 when we were supposed to be doing all this, so we're playing a little bit of catch up. But there will be a place online with a website where you can look at the Racial Equity Action Plan and different things that are posted that relate to it. There are a little bit of survey results on there right now and a few other things, so go check that page out. I think that's the link that you were given in the invite. All right, I'm going to turn it over so that we stay reasonably on time. Dante King is our new workforce equity guru. I'm giving you guru, who has been helping us in every aspect. So that means you might be recognizing a policy gap, and that is something that Dante is really going to focus on. It doesn't matter if we fix one situation at a time if we have done nothing to prevent the situation from just happening again. So we're trying to work on the system, not just on situation. So God bless you, and I hope we help you with your situation, but that is not where we can stop or use all of our time. And Dante's been doing policy. He's brought his expertise in both HR and racial equity and ethnic studies. So he is a multifaceted, multi-talented person who is going to tell you a bit about what's been happening so far in workforce equity. Thank you, Dante.
Thank you. Can everyone hear me? Awesome. Well, before I proceed to share, I want to acknowledge and also turn it over to our Director of Human Resources, Lowena Kim, who will be sharing some of her own thoughts. She is someone that I know very well. I think our rapport and relationship extends back to about 5 years. I also want to just take a moment to remind people that if you are a presenter and you've called in, please stay on mute so that we don't hear any noise distractions. But I want to turn it over to Director Kim so that she can talk about the work that we are doing together. A lot of my priorities that you'll hear me talk about directly connect and or are located within human resources. So with that said, I'll turn it over to Director Kim. Hi, Lowena, are you there?
If I went off mute, actually
Oh.
more people could hear than the empty office that I'm in. So thank you so much for that. So thank you so much, Director King. I am just really honored to work with you, and thank you for giving me a few moments to just chat a little bit, share about my background and my vision and thoughts. And I really actually am looking forward to dialogue and conversation and feedback, because I think through that, even though the conversations are difficult, that's where real change happens. So I thank you for allowing me a few moments. Good afternoon, especially during lunchtime. Thank you so much. As was mentioned, my name is Lowena Kim, and I'm very blessed to return to DPH. It's been about 6 weeks now to serve as your HR director. For those of you who may not know, I say return back because I started my career with DPH back in 2002 at ZSFG in labor relations, back in one of those brick buildings before CHN, before HR moved over to CHN. I left DPH in 2009 for the San Francisco Human Services Agency, where I managed labor relations in the Office of Civil Rights. And then for the past 7 years, I served as their HR director until late March, when I came over to DPH. Thank you so much again for inviting me to say a few words. Before I begin to share a bit about my background and my vision regarding racial equity and its deep connection and tie to the work that I do and my team does in HR, I'd like to thank and acknowledge the amazing, inspirational, and tireless leadership of Dr. Bennett and Director King. I am astonished every day about how much they have done and their commitment and their dedication. One of the main reasons why, as I was considering the opportunity with DPH, one of the reasons why I came over to DPH was for the honored opportunity to work with Dr. Bennett and with Director King. I feel really fortunate to collaborate with Director King because, amongst many other areas of guru expertise, he brings a wealth of experience and knowledge. He provides valuable insight and resources to those of us who are on various levels of our journey as we go through the racial equity journey. I am really deeply appreciative of their vision and their active movement towards racial equity. I know it's really difficult and they carry a lot on them, but it does change the lives, as we've seen and heard. It changes the lives of all of our patients and our employees. So my deepest gratitude for you. And also I honor the work of our equity leads because you too also have difficult and challenging work, and you are all an inspiration to me, so thank you. I would also like to extend my appreciation to Dr. Colfax, Greg Wagner, and other members of the executive team. In my 6 weeks, they have demonstrated through their words and their actions that racial equity is a core value at DPH. As others have said, and as Dr. Colfax had indicated, I firmly believe that it is really important that executive leadership value and embrace racial equity, not by their words, but through the allocation of resources and the way in which they model the environment, the welcoming, inclusive environment that we all deserve to be part of. A little bit about me. I'm the daughter of Korean immigrants. My parents came separately, but they came to the US in the early 1960s. Although I was born and raised in the US, English was not my first language. I started to speak English when I went to kindergarten. During my childhood, I was surrounded with members of a community, of an immigrant community. I left the West Coast and went to the East Coast, where I went to undergrad and grad school. And after graduation, I taught English as a second language. I worked as a public defender and served as an HR director for a public school system and was a recruiter. One winter day when it was snowing, I decided that I had enough of that snow, and I was fortunate enough to find something at DPH. So I packed up my car and came out here in 2002. I was raised with a passion for social justice and have continually sought opportunities to further advance equity and advocate for those who have been marginalized and silenced in our communities. We are seeing daily the amount of hatred against members of the BIPOC community through anti-Asian, anti-Black and Brown, anti-immigrant, so many anti-violent actions that are occurring. And I recognize, and although we have different powerful challenges and experiences, I believe that we need to work together to come together united in combating racism. As we see, they take the form of overt violence, but as some of the comments were made in the chat, they also come through less direct, but nonetheless as destructive through institutional and systemic systems, which have led to racist and biased outcomes that benefit some and not all, or disproportionately harm others. Unfortunately, it'll take time to dismantle these existing systems, but I'm committed to making the changes we need so that everyone who interacts with DPH will have the same outcomes. It won't depend on what you look like or where you come from or who you know to be able to thrive. And I recognize, and you recognize, that I can't do it alone, and the hardworking and committed HR team can't do it alone either. We have to come together through our actions, our feedback, our collaboration, and our willingness to be uncomfortable to make it happen in the direction that we all want and deserve it to go. When I say uncomfortable, I don't mean unsafe, but I ask that you be okay with uncomfortable when we're talking about these things. If you find that you're really comfortable when having these conversations about moving forward and advancing racial equity, please ask yourself, why am I not uncomfortable? Have I found comfort and familiarity in the structures and systems that produce inequities? Am I uncomfortable with challenging my own privilege? If you don't know how to proceed, if you don't know what to do, please reach out to your equity leads or Director King, who has many resources available for you to read and learn and grow. And I also am committed to providing resources for all of us to have that ability to grow and self-reflect. So as the director of HR in the area of HR, when it comes to hiring and recruitment, I firmly believe that an organization that is diverse is stronger. It makes better, deeper decisions that help organizations to thrive. And we have all seen this. When you have too many people who think and view the same way, then the decisions and the allocations of resources go to benefit groups that have historically always benefited, and they don't go to others, and they harm groups disproportionately. There were several questions on the survey that were asked about hiring, such as recency requirements and MQs, efforts to increase candidate pools in the Latinx communities, and whether and what we're doing to mirror our patient population. There are many really great questions in the survey that came, and I just wanted to acknowledge that those and other questions. And I would really welcome and would like to have more in-depth, deep conversations about each of those topics and others that you would like to bring. I have a lot to say, and I would love to hear your suggestions about them. I just want to be mindful of time, and there will be a Q&A, so perhaps we can have some discussion on that. But I am very open to hearing more about the topics and hearing your suggestions. Just one thing in terms of past work that I've done as when I was the director of HR director of HSA, my instruction to the HR exams team and the hiring team was be inclusive, find ways to bring people in, find ways to allow people to compete. don't put up barriers to exclude people. I think a lot of our processes are ways to exclude people, and we really need to find ways to bring people in. And so I've talked about looking at our MQs, our exams. When do we give them? Let's look at the data and see whether our processes are disproportionately excluding marginalized, unrepresented communities. The other part is we can do a great job in increasing diversity, but if we don't provide a welcome and inclusive environment, what's the point? What we're doing is we would bring in a diverse group of people, but we would be harming more and more people. And I know that there's a lot of conversation regarding corrective actions, and we should have those conversations. I think it's really important that everyone is held to the same standard, including those in management up and down the organization. And I also think it's important that everyone understand what is the expectation in advance and not afterwards, not after the fact, but in advance. We make a tremendous amount of investment in time in recruiting staff. We need to find a better way to help people succeed and thrive. We have to foster and maintain an environment of inclusion and investing in success instead of waiting for people to fail. My legacy, as I look through my career and my vision, is that through my HR-led efforts, which I'm very passionate about, my vision is that every staff member of DPH, every candidate, every individual who interacts with DPH, when we say this is the best place to work or the best place to serve the community or receive care, that every one of us is included in that best of. So thank you so much for giving me a few moments to talk. I look forward to going on this journey with all of you with humanity. If there are any questions, I'm happy to answer them or welcome further conversations. Thanks so much.
Awesome. I think we do have time for about 5 or 7 minutes of questions if you want, Jess, so feel free to.
Okay. Hi, Luana. Do you want me to read some from the chat or you want to answer some from the survey?
I think we could do some of the chat. I think that's fine.
Okay. So a couple of them that came from the chat, one particularly for HR. I'm sorry, I'm just going back up. Is really about looking at management accountability. So for this person put, the term equity needs to have a felt action plan that shows tangible results. This is crucial for many reasons, including saving lives and has to, and really thinking about the norms of upheaval. Like now, sorry, this is a long question, but really what's a significant effort that have been taken to address implicit biases that historically and inherently show up in the hiring process?
So yes, there's a lot in that question. There's a lot of work that needs to be done. So we have data and we have information. We have to find a better way of capturing it in order for us to identify and understand where the different barriers are. We clearly know and understand that there are barriers and that there are disproportionate there's institutional systemic racism that occurs in a system that has existed for 100 years. So we have to look at dismantling it and reviewing it and breaking it down in its various components there in order to address them. For instance, there are a lot of issues regarding MQs. Why do we have them? Are they mere barriers to being able to even apply for a job? Is it a narrowing of the door? And do we need to look at why is it that you have to have the MQs that you have? Why can't we open the door? Why can't we be more inclusive? Why can't we allow people to learn more on the job or people come with a richness of experience and they can bring them in different ways. You don't have to have a traditional experience or education in order to do a great job. And we know that experience and education has a sense of privilege behind it, and we have to look at those things. Our assessment tools, we have to have a careful review of them and see what are we really assessing what we need to, or are they, again, simply a way in which you go through a process and a system, and how do we explain the different, how do we explain our processes, which is really complicated and difficult to do. The other part that I look at and think about is even in our selection process, and whether we should think about ways in which, you know, I've seen in other places where interview questions, for instance, are given in advance because it's not meant to be a quiz in the moment, and not everyone does well in an in the moment sort of situation. And should we not think about ways in which we can create a better experience? Because interviewing and selection is a two-way street. It is not just employer out. It is a candidate also, and we need to sort of equalize that process. I can go on and on about this, but I do think there's a lot of work that we need to do. We need to collect and publish data, and we need to have conversations, and we really need to look at it from a candidate and employee experience versus what works for HR, what works for the system, because we know that we know what the outcome is of the current system, and we have to turn and change that. There was one question about holding HR accountable. Do you mind reading that one? Because I think that's a really important question to ask.
We're on the same page. That's where I was going next. So it says, how will we hold HR accountable when their procedures and outcomes are not aligned with the Racial Equity Action Plan?
I think that's a great question, and I really appreciate the person who had the courage to raise it. I absolutely believe HR needs to be held accountable for its policies, its decisions, its systems. I am mindful, being in HR, about being a leader in an area or function that has components and areas of systemic racism and institutional racism. And I have to say that as I do this work and I think and I see different issues and I hear about different things, I constantly struggle personally and professionally about the need to make change, because I ask myself, when you don't make change, are you complicit in allowing what is currently existing? And none of us want to be complicit in this. And I do absolutely think that it is important to make HR accountable. I think we need to do a better job in publishing the data and the information in various components within HR. We need to be open and humble about having the conversation and receiving feedback. I can tell you that even though it may be challenging and difficult to raise and to hear, a lot of really great changes and important changes have been made because of issues that were raised by individuals. And it's unfortunate that change has to happen because someone has to raise the issue. The goal and the idea would be that we would get in front of these, because every single decision that HR makes, I understand and see that it impacts many, many people. And so I do see a need to do that, and I encourage and ask for accountability in a respectful way, please. But I ask for accountability because we're not going to be able to make the change that we all deserve and want to have without having that conversation, that dialogue. And I'm very open to that. So thank you for that question.
Thank you. And then one more question before we hand it off to Dante, but I do think it's important to think about our contractors. As you know, DPH we contract with a lot of organizations such as Haluna Health. So how do we bring them along with our Racial Equity Action Plan so that they're on the same page of how DPH is doing this cultural shift?
I think that, and I'll give you my initial response, and then I need to do more research on what are the expectations that are given to our service providers, because I do believe that those in contracts are an extension of the work that we do. It's not us and them, it's a spectrum, and a lot of our patients and communities experience us through that spectrum. I think it is going to be important to hold them accountable and be part of the conversation hold them to, so there was another question actually in the survey regarding the need for our staff to mirror our patient population for many reasons, for understanding of our culture, our values, the differences of where we come from, and our contract providers need to do that as well. But I will look more into that and provide more information on that. Thank you for that question, because I do think it's an important one.
Okay, do we have time for one more, Dante? Are you ready to go on? I know we have a minute left.
Sure, we can ask it. That's fine.
Oh, okay. Just one more question, and then we can move on. One person asked, do you have an open door policy to talk about recent and past discriminations for Black and Brown people?
Absolutely, I'm happy to have the conversation. I will. I will also. Director King has also been a great collaborator and mentor and partner. So I absolutely would love to hear that, and will collaborate with the OHE office and equity leads on what is the best way. And I'm happy to do a one-on-one, but I'm also happy to hear it in a form or whatever way in which is the best way to have the conversation. But I know I only have 1 minute, but I also feel that I have been very fortunate and blessed when I was at HSA with the team, especially the HR management team there, in particular Dr. Williams and Director Asa King, who really through their grace and their patience and their commitment to racial equity, have allowed a conversation, or we were able to have a conversation which got uncomfortable at times, but that really developed me on my racial equity journey. And I have a long way to go, and so I think it's a lifelong journey. So I do look forward to having conversations, because it will help me and inform me and help me to self-reflect. So I look forward to those conversations. So I thank you for that question.
Awesome. This has been great. I have to say, I am so thankful to be working with people who are demonstrating such leadership and authentic leadership and commitment. And thank you, Director Kim, for all of the experience that you bring and the passion to this work and to these efforts. So I hope that that's resonating with people. I'm really looking forward to our relationship as we move through this journey together. I did want to just share briefly, there was a question in the chat in terms of data pertaining to disciplinary actions, disproportionate disciplinary actions and outcomes. And I wanted to amplify that in 2018, I believe it was September 2018, Mayor Breed signed off on a directive, or issued a directive for all departments to produce disciplinary data ongoing so that the city can have it. And we have since been collecting it consistently. And there have been 2 years, I believe, of reporting, years 1819 and 1920. And what both years demonstrate very clearly is that we do have a problem as it pertains to our Black and African American workforce across the city. So that report, I know one of the versions of the report, it can be located on the DHR website if you are interested in the report section. But what it demonstrates is that across all departments, whether it be the Department of Public Health, the SFMTA, the airport, PUC, Black employees are disproportionately disciplined significantly. So with that said, I will take over and just go into presenting some updates that I have been working very closely with the HR team to set into play. And I want to, since Director Kim hit on so many of the points that I was gonna cover, I will cover some things, but I also wanted to frame what I am going to share with you. And so I'm going to read an excerpt from this book. I'm not sure if you can see it, but it's called The White Racial Frame. Some of you have heard me reference it. It's by Dr. Joe Fagan. And it talks about how we are all socialized through the lens of whiteness in the ways in which we learn our language, our educational subjects as we develop throughout our lives, our educational institutions, our governmental, political, legal institutions, normative standards, behaviors, the ways in which we set conduct expectations, all of that is through a Eurocentric, through a European, a white male patriarchal European orientation. And so the excerpt from this book that I'm going to read, it says, as a matter of everyday reality, Americans of color, including immigrants from Latin America and Asia, are more or less forced to accept much of the existing white racial frame and racial hierarchy. The most white-controlled media and schools aggressively press them to conform constantly over their lifetimes. They learn that they must, more or less, conform to many white-normed and white-framed societal realities so that they can survive in this still racially oppressive society. Indeed, they must adapt much more cooperatively to many of these social pressures, such as in learning English, the English language, than a great many whites are willing to give them credit for. And so what this brings into view, I also want to reference another book by Dr. Ibram Kendi, which is Stamped from the Beginning, The Definitive History of Racist Ideas in America. What this brings into view, and I really refer to these texts as the pinnacle and foundation of how I'm moving through my work, are the ways in which we have to maintain that the system is broken. It is unfair with every breath that we take. It is a biased culture. It's a biased cultural orientation. These are biased professional or biased institutions that we all exist in every day. And so we must continue to maintain that white supremacy is the problem and not people. And as we continue to require people to conform to certain things, we have to consider how much harm is that causing? Are we continuing to pathologize people or potentially cause them to be harmed by making them the problem, their lack of experience, their lack of education, their lack of an ability to exhibit professionalism in the ways in which white normative mainstream society has constituted that needs to happen. And so when we talk about creating an inclusive culture of belonging, how do we ensure that we build a culture where we consider the challenges and the barriers that various institutions have to deal with as they're coming into our agency so that we can be able to change the context of how we provide support and also how we develop. So I will speak a little bit about that as I move on. This should be relatively quick. So we can go to the next slide. This outlines several of the key updates that I'm going to give, which references a few of the policies and links to some of the things that we've already hit on. I will also give some examples of divisional collaborations that I've been partnering with different leadership throughout our agency to put in motion, as well as share briefly about the fellowship that was recently established for our leaders and managers throughout the agency. All right, we can go to the next slide, please. So when we look at recruitment and hiring, particularly, one of the things that I've worked pretty vigorously to with the equity leads, with the HR operations team, so Karen Hill, Kimberly Walden, Ramon Williams, and Carrie Johnson, and their teams, is to really document our practices and protocols with how we do our recruitment and hiring, but also reshaping and reframing the variables that are contained within that process, such as job announcements, providing structured language to go into our job announcements so that we can recruit from the right populations that we need in order to diversify our staff. So this links, and this is across all levels. And so this links directly to what Director Colfax spoke to earlier, ensuring that we allocate resources, that we are intentional about doing that and actually mapping it out in the policy about where to go, who to refer to be able to do it, right? We also know that some of the things that we deal with in a civil service environment, we might be constrained in some ways because for many of our our positions or processes, we have to abide by the civil service rules, which might be a rule of 3 scores in some cases. It could extend to a rule of 5, depending upon what's worked out. But this is providing steps to guide us to think about, what does it look like to ensure where necessary, where we might want to extend things to a rule of 10, so that we make it equitable. We understand that our testing even is biased, so everything. And so how do we make the most of the resources that we have at our disposal, but also make changes where we need to? We can move to the next slide. So on the front and back end, it's also looking at, in our post-selection referrals, we have all of this training, fairness in hiring, managing implicit bias, but how do we not only interrogate and hold accountable our processes, but people? So when we're engaging in, let's say, a hiring panel, and we're vetting people, how do we ensure that we challenge decisions that are being made? So if we know that we've hired, from amongst and within particular populations, and we have staff in certain classifications that are represented from particular populations, how do we challenge, is it the process that's causing these outcomes, or are these due to biases, and not necessarily individual biases, but individual biases that are based on cultural preferences in terms of how we are sizing people up when they come to that process? Because I can be the top candidate in a process, I can score really well in terms of an app review, but when I show up to the interview, I'm still Black. When I show up to the interview, I'm still being interpreted through the lens of, someone who is well prepared or presenting, but as a Black person. All things are not equal at all. So how are we challenging all of those things, but also being intentional about making decisions to ensure that we can ensure that we have a diverse workforce? We can go to the next slide. I've been working, as Director Colfax indicated, across different divisions. So with Director Hallie Hammer, who's over ambulatory care, Anna Robert, who's over primary care, Director Joseph Pache, Robin George, who's the equity lead, on the 5 medical director recruitments that we currently have out there. We've put together a pretty robust marketing strategy and recruitment strategy. I also want to thank HR there, Tina Hinnat and her team, Tara and Randy, for being very diligent there. I've also been working and had some contact with Michael Phillips, Director Michael Phillips over at Laguna Honda, Monica Biley, and Andrea Turner at Zuckerberg, Susan Ehrlich over there too, who's the hospital chief. And so we are also working on ensuring that we put together strategies so that we can diversify not only just the workforce in certain places, but we have taken a pretty comprehensive look at the breakdown of who's located in specific classifications. And we've prioritized that at the director level, at the within our physician classifications, within our nursing classifications, that we make some pretty intentional moves about how we move through these processes to diversify where we have underrepresentation and a lot of gaps that speak to this. I've also been involved with guiding the construction of job announcements and doing a lot of consults with people about the language to include. And so a lot of this language is directly located within the recruitment and hiring policy that we've constructed. It's currently about 9 pages, going on 25, but there's a lot of finite guidance about how to navigate these processes with equity at the core. So I'll move on, actually. But there's more to come on that. We can go to the next slide. I've also provided some specific feedback. We've had several cases here recently where candidates of color in mid to high level positions were adversely impacted when they took the test batteries. The logic that underlies the test batteries in many cases is very biased. It's subjective. It's based on people who put those test batteries together, who came from their experiences with how they learned what management was, whatever research they collected that helped them to put together the situational test batteries. In one of the cases, we had someone who the test timed out for. And so one of the things that came up for me was that for people who might have barriers in terms of accessing the English language that might be different from someone like me, where English is my first language, how do we require those individuals and provide them with the same types of time than we would someone who speaks English as a first language to then be able to execute that test the same? It's not fair at all on its face. And so we're working to rectify and address those issues. I'll be doing a lot of collaborating with Director Carol Eisen at the Department of Human Resources, as well as Director Kim, who will be involved in such processes. And then the Office of Health Equity plans to provide the HR director with a copy of the recruitment and hiring policy so that we can work through finalizing the details of that policy and then potentially implement it within months to come. All right, we can move on. So I did provide leadership with some actions about reviewing the policy and coordinating with some strategies with their equity leads. So that's currently in process. Next slide, please. In terms of our code of conduct, we've talked and hit on a little bit about discipline, our disciplinary outcomes and issues. Director Bennett spoke to issues with over-enforcement and under-enforcement, and we see that happening. I can share just within the last 2 months, I've been consulted, I've been asked to intervene and or collaborate with helping to remedy some issues with certain employees. And all of the employees that I have been asked to maneuver through processes or to provide support for, whether it be directly with the employee and or with leadership, they have been Black and African American, spanning different ranks within our agency. In one situation, there was just a breakdown of communication, right? And also understanding. So this links directly to the first area that I covered in regards to recruitment and hiring, because we want to be able to locate leaders and managers who understand various people from different backgrounds that can provide support and be flexible in how they provide support from people from different communities, because that's a part of ensuring that we develop leaders who are culturally competent and also able to flex to be effective, more effective in how they lead their teams. Because the more effective we are as leaders, the better our teams function, the better our people function. And that's what this is about. So we have developed a process that will support the implementation of the respect policy, which is within our code of conduct. There's guidance about how to conduct and intervene in situations. There's a guide to workplace investigations, which is about 25 pages that we developed that provides specific guidance to leaders across the agency. And then there's also an employee complaint form, which we are looking at how to implement so that we can collect employee experiences, but also be able to respond to them in a timely manner. And then we also developed a marketing and communications plan. All right, so we can go to the next slide, more to come on that. And I partnered with everyone from all of our equity leads to our EEO manager, our labor team, Rhonda Simmons, Director Rhonda Simmons and her team, Office of Health Equity, Union Shop Stewards. We involved our city attorney partner for guidance and review of the policy and process. So it's been a very collaborative effort. So we can go to the next slide. So I just talked about the material, so we can move to the next slide there. And I do expect to have a draft of that. We met with the HR actually yesterday, and so they will receive a copy of the draft of all of these items by the end of May. And so we will be working on how to implement them. Next slide, please. And then lastly, and this links directly to everything that we've talked about, because it's important for us that when we talk about reshaping how we function as an organization, how we value people, how we support people, how we develop anti-racist approaches, how we develop racially equitable approaches. This leads directly to what Director Kim and Director Bennett spoke to, and Director Colfax, in that we have to have leadership who is leading the charge, and not only just doing lip service, but consistently challenging ourselves, consistently challenging processes when we are not reaching our goals of equity, when we have empirical data in front of us that demonstrates that we need to do things differently. That hinges on us developing a leadership culture that can be collaborative, that can come to the table and share our different perspectives based on how we are all walking through the world. There are different experiences that some people have from the Latinx community, and if they're not at the table to talk about ways in which we need to be supporting and or doing things to elevate and or address issues for that community and or impact how we are doing things for our organization, it gets missed. And so we are losing out on the value of that diversity brings, actually. And so this program, which is an Anti-Racist, Equitable, and Inclusive Leaders Fellowship, will run for 5 months. It's very intense. There's at minimum, 60 to 70 hour time commitment. It will run every Tuesday throughout the months of June and July, for every Tuesday throughout those months for 4 hours a week. And it includes a very rigorous learning component, a reflection and examination component that revolves around implicit bias, racial inequities, as well as an intensive that focuses on coaching, mentorship, and being introduced to different anti-racist frameworks that will shape organizational change. So it will be open. We're planning to run it, this will be the pilot, but we're planning to run it 3 times a year. And in doing so, we expect to see changes in how we function as an organization, internally and externally. So I'm really excited about that. And I think that's it. We can go to the next slide. There might be, yeah. So that we can stop here because we're running out of time. So if there are any questions, I can answer a few.
Yes, there's a lot. Do you want to do the chat or the survey question? We do have a lot from the chat, though.
Okay, that's fine. We
Okay.
can take from the chat.
Okay, and some of them you touched on, but I will go to the examination questions. So one is when we're looking into the hiring process of examination for positions, because some of them, the exam can discredit certain candidates who are fantastic in their work, but may have not passed the examination class, which eliminates them from the hiring process. Is there any way to look at like a holistic approach to addressing, when a candidate may be great for the position but may have not passed the actual exam? What are your thoughts on that?
There are so many components there. I think one of them I did speak to, which is it better to, in the exam content, is it relevant to the classification and the position that's being filled? And if it's not, maybe we use a supplemental questionnaire as a tool that's more relevant, and we look at how harms are being caused, who's being impacted. I think we need to absolutely run data on who's passing certain test batteries. Are they even relevant to the positions that are being filled? And really do our due diligence in that area. I will defer to Director Kim if you have any thoughts on that as well. And then we can just take one or two more questions.
Thank you. In the interest of time, I will say this is an area that needs a lot of review. It is one where examinations are given as a matter of course, and we need to do a lot more thought and research about why do they exist? What are they really assessing? I read a really interesting research that says that, or an article that said that people of privilege are assessed for potential. People of color are assessed for their last performance. So we're not assessed for the same thing. And we need to find ways to assess for potential and not for past performance, because we all know that past performance is governed by, is dictated by things that are outside of our control, that are controlled by the majority. So this is an area that I share in Director King's passion and others in really looking at and dismantling the way in which we go about, and I talked about this, the doorway, right? The door in which people can enter. We need to really look at that and widening the door and providing multiple opportunities for ways to come in, rather than a door that is artificially made narrow. So I do really appreciate this conversation.
Absolutely, and I also want to amplify Dr. Caretha Mitchell, her book From Slave Cabins to the White House, which recently came out. She talks about how it's demographics that governs how we're treated, and that there are the standards that we abide by are put in place to control people of color, but that white people do not adhere and or necessarily have to adhere to those standards. And even if you look at studies in implicit bias, there's one particular that I refer to, which is a legal memo study where they divided the two control groups. And they said that, one candidate was white, his name was Thomas Meyer. The other candidate was black, his name was Thomas Meyer. They had the same education, etc. And they scored the memos very differently. I mean, I can share the link with people, but just based on the interpretation of who was behind writing the memo, it got very different reception. And then I also put a link in the chat that looks at, which is a study that was done by Harvard, where it followed young black male children and young white male children, and even those who were black, who were affluent, who came from very affluent households, they were more likely to end up either in deep poverty, lower class, lower middle class, or middle class, whereas you had white children who were from poor situations or families who were more likely to end up affluent, upper middle class, or middle class in over 70% of the cases.
Thank you. Okay, I wanted to go to the survey questions because I know we only have a little bit of time, and I wanted to make sure people who put their questions in were able to answer it. And we probably only have time for 2, but this is just in response to, you know, what we've been seeing in the world, you know, the murders of African American, and this person's asking, you know, if DPH is going to consider, you know, the murdering of African Americans being a public health crisis. And, you know, what do we plan to do to really address or acknowledge how physically weighed down African American staff are feeling emotionally and physically, with even addressing this pandemic too, and also addressing, you know, having to deal with this racism and how people are feeling. And I know this is more focusing on the workforce, but maybe you can speak to that, Dante, on, you know, what you think our plan as a department should be when addressing these concerns and these issues that are happening.
I will say quickly that I think, you know, one of the things that we put in play to address recent issues that we that we've seen and our communities and families have experienced around the anti-Asian hate, and the continued pervasive anti-Black blackness that pervades our society, were the forums that we held that were led by, in partnership with the Office of Health Equity and HR and some other key people. And so that's one thing that we are working to establish and normalize. But again, in understanding how those things impact people from communities of color, we have to step up our game in the ways in which we support people with actual tangible solutions. So that's in how I coach. That's in the empathy that I demonstrate as a leader to ensure that if I gauge that employees might need time away or to take time off, I'm able to support that. I understand that people from communities who are steadily impacted in a way that is unrelenting by these societal traumas that continue to be inflicted upon us, that there is a higher degree of support that we need. And all of our leaders, we as an organization, have to understand that and institute processes that can allow for those types of considerations. And so I am working on something that is pretty substantial. I won't speak to it right now, but if it is supported by the organization, by the leadership within our organization, this could really be something that is a dynamic game changer in the ways that we are putting our stamp on the equity work that we are doing. So that's, I won't share any details, but please know that I am considering all of these variables in my work. And thank you for the questions. So I know we are at time. I just want to say thank you to everyone who joined the call today. Thank you to all of the equity leads for your leadership, your thoughtfulness, your collaboration in doing what you do and what we are doing together. I want to just give a nod to Director Colfax for putting his stamp of approval behind all of this work, because we couldn't move it throughout the organization if it were not coming from the top, no matter how much passion I have, or Dr. Kim or Dr. Bennett. I also want to give a nod to my leader, Director Bennett. It has been such a great pleasure. I keep waiting for the shoe to drop. Like, when am I gonna feel like, oh, I'm not sure, because that hasn't happened for me. And usually by month 2 or 3 it happens, but you are a phenomenal leader. I could not have asked for a better situation. Thank you for removing the obstacles and just for your leadership, your dedication, tenacity, the way that you challenge me and all of the equity leads. You're just amazing at what you do. And I also just want to thank you again to Director Kim for you were just the right person to be here at this time. And I'm thankful to have the opportunity to partner with you. Dr. Bennett?
I just want to end by saying we will have to keep talking. Someone made the point that the Racial Equity Action Plan is ambitious. It doesn't quite fit our usual format for improvement work, which is the more priorities you have, the fewer you have, because you don't have any now. We do still have priorities. We have an equity A3. It has very specific outcome goals. There are, I think, 5 of them or something, not 85. But we do have to go through all of those activities. We did not write it. It's required by the Board of Supervisors. We will do what we can to put more intensity, more time, and more priority to the things that we know you've told us are critical. So there are some things that will in fact be checkboxes because we cannot put the same intensity to everything, and we're not going to check off hiring, which needs a lot of work, or check off training of managers, which needs a lot of work, so that we can spend extra time thinking about the posters that are in the clinics. So everything's on there. We didn't put any of it on there. We added some things, but the vast majority was dictated for every department by the Office of Racial Equity. We will get through it and watch for the updates on what the key things are.
All right. So we are at time. It's about 1:35. We want to thank everyone who took time out to join this town hall kickoff. We will be doing this roughly 3 times per year to provide updates about what's happening, because we think that one key ingredient is communication and ensuring that we keep you all abreast, because you all are being impacted by the efforts that are taking place, and we need to hear from you. We need to feel and know that you are being impacted by the work that's being done. And I also just want to very quickly say thank you to the employees who have been here for a very long time rallying for these efforts. Brenda Barrows, people like Brenda Barrows, Joe Elias Jackson, Cheryl Thornton, Daniel Becker, Kim Lynch. There are a lot of people who have been just kind of in the trenches doing grassroots types of work. And this would not be happening without your vigor and without your persistence and commitment as well. So thank you. That's it. Bye, everyone. Until next time.